My next guest is a regular contributor on the show. He's a psychologist who specialises in the treatment of anxiety disorders, and he works for the Anxiety and Stress Reduction Centre in Seattle. Dr. Travis Osborne, welcome to the show.
Hi there.
Or welcome back, I should say.
Yes, thanks for having me back.
Regular on the show now. So today we're going to talk about a very common type of anxiety. Well, it's kind of one type with two subtypes. It's panic disorder. Now, tell us a bit about first of all, what panic disorder is, and then we'll go into a bit about panic attacks. Yeah. So what is panic disorder?
So panic disorder is a disorder in which an individual starts experiencing recurrent and kind of unexpected or out of the blue panic attacks. And in response to that experience, starts doing one or more of these two following things. The first would be having a lot of worry or anticipation of having additional panic attacks. So they spend a lot of time throughout the day really wondering, like, am I going to have another attack? And the second thing that people might start doing is starting to avoid different types of situations, maybe where they've had panic attacks, so that they feel like they might be less likely to have them. So if the person maybe was exercising and had a panic attack, they might stop exercising or kind of scale back on their exercise. Or if they had gone certain places and had panic attacks, they might start avoiding going to those places out of worry that it might trigger another attack. So it's really this ongoing worry about having panic attacks, and then this avoidance of situations that might evoke panic for them.
So let's just, for anyone that doesn't know, what are some of the physical symptoms of having a panic attack?
Yeah, so panic attacks, interestingly, are actually a pretty normal experience. Many people in life will have a panic attack at some point in their life. And a panic attack involves having at least 4 of 13 different symptoms that usually kind of peak in this really intense feeling of fear or anxiety that can come on very suddenly and kind of peak within about 10 minutes or so. Those symptoms can include a whole range of things, including kind of racing heartbeat, difficulty breathing, feeling a tightness in the chest or pain in the chest, sweating, sometimes trembling or shaking. People can feel either kind of cold chills or sometimes the opposite of that, kind of hot flashes. People can get upset stomach, and also some symptoms of worrying if the individual is going crazy. So sometimes when people are having this experience, they think, God, am I going crazy? Like, what's wrong with me? Other times people are worried that they might be having a heart attack or that they actually might be dying. And other people just fear that they're going to kind of lose control. The feeling of having a panic attack is so scary. People feel so out of control of their own bodies that they just sort of imagine that they're just going to completely lose control. Other people start to feel really disconnected from themselves or what's happening around them. So people will describe it almost like they're watching a movie of what's unfolding, and it's not really kind of them happening to them. They're like observing it happening. And dizziness, lightheadedness, numbness or tingling in the fingers or toes can happen. So really this whole range of physical and cognitive symptoms. And to have a panic attack, kind of meet criteria for panic attack, you need to have at least 4 of those in that particular experience. And
it's not, although it feels dangerous and it feels like someone might lose control, it's important to stress that it's not really dangerous, and that most of the symptoms that people would feel, if not all, unless they've got some underlying medical condition, wouldn't actually necessarily result in the fears that they have.
That's right. So most people, when they have a panic attack, actually go to the ER, the emergency room, because they believe they're having a heart attack or that they're having some other major kind of medical event, because it's really a scary experience. And what we know to be true is that all of the physical symptoms that people have in a panic attack are actually totally normal and a hardwired part of the body's response to threat. So panic is part of what we call the fight or flight response, which is this hardwired response that we have that keeps us alive, that if there's threat in our environment, that the body goes through a number of changes to get us ready to either kind of fight off, whatever the threat might be, or to flee or escape it. And so in order to do that, the body's kind of like firing up all of these different physical kind of engines in the body, so to speak. And so people start experiencing the symptoms of that. Their heart rate increases because the body is trying to pump blood, throughout the body to kind of oxygenate blood, get people ready to run or to fight something off. That leads to these changes in breathing more quickly. All of those changes lead to things like sweating and feeling kind of lightheaded because they're breathing more deeply than they were before. And so all of those changes are really perfectly normal, but they feel terrifying. So people really can misattribute kind of the cause or the source of what's happening to them as being some really serious or really dangerous physical event.
And a very common one can be that people feel like they're going to pass out.
Yeah. Yeah, that feeling of,
again, that's just a feeling. It's not reality, is it?
That's right. Actually, yeah. What's interesting is, in order for people to pass out, blood pressure has to drop, and in panic, blood pressure actually increases because people are feeling more anxious, and so people are actually very unlikely to pass out when they're panicking. But because they're breathing so quickly, or maybe sometimes having a hard time breathing, and so then they start to feel lightheaded. They get this really intense sensation, sometimes of dizziness or lightheadedness, that makes them think they're going to pass out, but they're actually very unlikely to pass out. And actually, from an evolutionary standpoint, it would be really terrible if our response to threat was to pass out, because we'd be very vulnerable, and we probably would not have survived as a species if that was true. So biologically, our body is kind of tricking us almost into thinking that, a lot of these bad things are going to happen, when in reality it's designed to keep us safe.
And that's also where the fight, flight, or freeze thing comes in as well, because a lot of people want to bolt or leave the situation immediately. But actually, if there was a tiger chasing us, then it would be really useful for us to be able to do that. It's just that in the supermarket, obviously, it's not so scary. It's not, the food is not going to jump out and get you.
This is really kind of a key point about panic, which is this is really an evolutionarily important function. Hundreds, thousands of years ago, the kinds of threats we experience in our daily environment would be things like, running from a large animal, or running from another tribe, who is attacking you. And so you need your body to do all of these things just for basic survival. The problem with living in a modern world is that most of the time there are not these really significant threats around us. You gave a great example of someone might have a panic attack in the supermarket. It's really not helpful to have all these symptoms of this fight or flight response happening in the supermarket, because there isn't anything, more likely than not, anything that's all that dangerous to you in the supermarket. So our brains were designed, for kind of a different world really than we live in today. And there's this mismatch between how fear can get triggered and the level of threat that's actually present in our day-to-day lives. Now, having said that, if somebody lives in a very dangerous neighborhood, lives in a war zone, all of these symptoms would make a lot of sense, but the majority of the people in the world don't live in those settings. And so there's this mismatch between what our bodies are wired to do and the amount of threat that's actually in the environment.
So one of the things that can happen when people have maybe 1, 2, or 3 panic attacks and they don't know what's going on with them, and they maybe retreat and they're scared and they get all these scary feelings and thoughts, is that very quickly they can start to avoid things, situations, places, and that their life and what they do in their life in a very, very short period of time, if they don't know any better, can get very restricted. Tell us a bit about panic disorder.
Yeah, so you really described that very well, which is when you've had 1 or 2 of these really terrifying experiences of having a panic attack, you either go to the doctor and they think you're having a heart attack, and the doctor tells you, no, you're having panic attacks. Some people don't make it to the doctor, and they're just trying to make sense of what's happening to them. And what they start to do is look for patterns. Is there anything that I can connect to what I was doing or what happened when I had a panic attack? Because the panic attacks feel very out of the blue. And so someone might have the experience gosh, I was on the treadmill at the gym and I had a panic attack, so I'm just going to not go to the gym or get on the treadmill anymore. Or I had a panic attack when I was riding, the subway or the tube, and I'm not going to go in there anymore because maybe that's what triggered it. Very quickly, life can start to shrink. People can have the experience even within just a couple of weeks that their lives are just shrinking rapidly, and they're cutting out more and more and more of the things that they think are causing their panic attacks. Now, what's a really important thing for people to understand is that although these panic attacks feel out of the blue, when we start to work with people, what we see is that they're virtually never out of the blue. And what happens is that first experience of having a panic attack is so frightening that people start to become very tuned in to being fearful of just the experience of being scared. So, for example, if someone has a racing heart during a panic attack and it feels like they're having a heart attack, they will start to get conditioned to notice anytime their heartbeat starts to increase or that their heartbeat starts to race. And when that happens, they will start to have panic symptoms because they're really worried they're going to have a panic attack. Well, there's tons of things in our daily life that increase our heart rate. Jogging to catch the bus will increase your heart rate. Watching a scary movie will increase your heart rate. Drinking coffee and caffeine will increase your heart rate. Going to the gym will increase your heart rate. So people will start to think that it's the gym or the coffee or the movie that is triggering their panic attack, but in reality what's triggering it is their own fear of their own body sensations. And so when we think about panic disorder, it's really a fear of fear. It's a fear of being in that anxious and panicked state. And so what we do is we try to help people see that what they're actually reacting to is their own body sensations, and that they don't need to then be associating the panic with all of these kind of external events. It's really fear of their own bodies.
So somebody's maybe having panic attacks and they've maybe been starting to avoid things. What are some of the key things to get them back on track, to overcoming this, to getting them less scared of experiencing it?
Yeah, I'd say there's kind of three main things from a behavioral perspective that people need to do. The first is to really identify, okay, what situations have I stopped doing or am I avoiding, and to really start to push themselves to get back to doing them, because the more that they avoid, the more quickly life is going to shrink. So we really want to start to help people kind of expand the scope of their lives again. The other thing is that people who have panic attacks start to develop a lot of safety behaviors. So if you're worried that you might pass out or have a heart attack or go crazy, you're going to start doing a number of things to help keep yourself safe. You're probably going to start carrying like your cell phone with you at all times, so that if you felt like you were going to pass out, you could call for help. You might start keeping another person with you, like whenever you leave the house or whenever you go out, so that in case that happens, someone is there with you to help you. Some people will start carrying anxiety medication with them wherever they go, so that just in case they have a panic attack, they can take it. So all of these safety behaviors really actually make people feel safer temporarily, but set them up to not understand in the long term that they could get through all those situations just fine on their own. So we really got to help people decrease those safety behaviors. The last thing and the most important thing we need to help people do is become comfortable with their own body sensations again. And so what this looks like is having people purposely evoke the feelings of panic that make them so scared, like increased heart rate or shortness of breath or sweating or feeling hot or excessively cold. Doing things to provoke those physical symptoms on purpose, so that the person learns again that those are just normal body changes, body sensations, and that they become not so afraid of them again.
And is there anything specific that you'd advise people to do if they're in the midst of feeling this kind of anxiety, panic, while they're feeling it, to allow themselves to desensitize to it?
Yeah, there's two things that can be really helpful. There's a type of breathing technique called diaphragmatic breathing that can be really useful for people who are having panic attacks, and it's a good skill that people can use when they actually notice a panic attack ramping up. And essentially what that involves is kind of slow, controlled breaths into the diaphragm or kind of the stomach area, as opposed to kind of into the chest or the lungs. And practicing this breathing technique and then being able to use it kind of successfully when people are panicking can be a way to help them just calm their bodies down, so that they can also approach situations and try to stay in them.
Because it's the breathing, isn't it? It's the breathing that can be a precursor to a lot of it.
Absolutely. The breathing is really kind of the engine of the system, because if people start breathing very rapidly or very shallowly, that is what leads to all of these other physical changes in the body. So if you start breathing really fast, you're going to get lightheaded, because the ratio of oxygen to carbon dioxide in your brain changes, and that creates a sense of lightheadedness or dizziness. If you start breathing faster, your heart rate, goes faster. So if you can start to manage your breathing and kind of control your breathing, you can really slow down the whole kind of fight or flight response. So that can be a really powerful tool. The other tool is really helping people challenge these beliefs that they're going to die, or that they're going to go crazy, or that they're going to lose control. And to do that, what we look is really just help people notice the evidence. Like, many people have had 50, 60, 80 panic attacks, and they're still having the thought that they're having a heart attack, when all of the evidence suggests to us that, in fact, they're not. They recover from these situations just fine, and their doctor's given them a clean bill of health. And so really challenging those kind of catastrophic thoughts in the moment is a helpful way to slow down the nervous system and slow down the fight or flight response too. But all of that, the breathing and the thinking strategies, are really tools to then help people start confronting the situations and the physical symptoms that have made them so anxious in the first place.
And another aspect that can arise from all this is agoraphobia, and I think there can be a bit of confusion about what that actually is. People have a common misconception that it means that people are stuck in their house, but there's a bit more to it than that, isn't there?
Yeah, it's actually a lot more complicated than most people know. At a very severe end, agoraphobia does look much like people being unable to leave the home and people being so anxious that they really just don't leave the house. But there's lots of people with agoraphobia that actually do leave the house and can navigate the world in certain ways. At its basic level, agoraphobia is a fear, an excessive fear, that the individual is going to have some sort of symptom attack, and I'll explain what that means in a minute, but some sort of symptom attack in an environment where they feel trapped and cannot escape. And so how this relates to panic disorder is about 30 to 50% of people with agoraphobia develop agoraphobia because they had a panic attack, because they had this really scary and intense panic experience. And if you can imagine, there's a difference if you have a panic attack when you're kind of just in the safety of your own home, or maybe, out on the street and you can kind of then get to your car or wherever you need to go. And the difference between that and having a panic attack, let's say if you're riding a bus or you're in a train or you're in an airplane where you are really trapped and you cannot escape. Or let's say you're in a very, very crowded area, and it'd be very hard to kind of get out of that area if you were to have a panic attack. So agoraphobia involves this fear of being in specific types of situations that's hard to escape. Crowded spaces, public transportation, long lines, anywhere that'd be difficult to escape. So a lot of times agoraphobia develops from panic attacks. What most people don't know is agoraphobia can also develop out of a fear of having other kinds of symptom attacks. So people can be fearful that they might lose bladder control, for example, in a crowded area and not be able to escape, and that would be very humiliating or embarrassing to them, or lose bowel control, or maybe pass out and faint. Usually the worries with those kinds of symptoms are more kind of a public embarrassment kind of worry, that it would be socially really humiliating if that happened. Whereas with panic, sometimes the worry is both embarrassment, but also that they might actually, have a heart attack or pass out and hit their head and, those kinds of things.
So more about kind of hurting themselves physically, panic attacks are, whereas this is more fears around kind of, in a way, what people think of them socially.
Absolutely.
Like humiliation kind of thing. So if we take the example of someone that may fear losing some kind of bladder control, because that would be a kind of taboo one that people don't talk about that much.
Yeah.
Take us through, so someone develops this fear. What typically happens at the point where they have a panic attack and they suddenly have this thought, or maybe the panic attack is caused by this thought, oh my goodness, what if this happens? And then what happens? Take us through what might happen with someone.
Yeah, so if someone can develop this fear, what they would start to think about is every time they would go out into the world, they would start to sort of anticipate where are the places where if I really had to go use the bathroom, would it be very hard for me to do so, and where would I get stuck? And so a lot of the safety behaviors that are involved with this kind of fear would be things like really limiting the amount of fluids that they drink, particularly when they're outside the house. So people I've worked with this fear will just literally not drink any fluids the whole time they're out of their homes because they're too worried that it will lead to needing to use the bathroom and that they might lose control of their bladder if they can't get to the bathroom in time. The other thing people will do is kind of map out in advance where they're going, kind of figuring out where all the bathrooms are, restrooms are in the areas where they're going, so they know that if they have a symptom attack, they can actually get to a bathroom.
Just to be clear on what a symptom attack is, what is actually a symptom attack?
The symptom attack would be I'm suddenly in a public place, I am going to lose control of my bladder right now, and actually the fear that most people have would be that they would basically urinate themselves in a public place before they could get to the bathroom. So that would be the symptom attack in this case, yeah. So all of these safety behaviors would start to develop, and the person would really engineer their day kind of really around whether or not they're going to be able to have access to a bathroom. And they might really just start avoiding certain things like long car rides, for example, particularly if other people are in the car. So road trips, might be out. People might avoid kind of having meals with other people in public because they'd be worried that if they drank too many fluids, they'd be having to run to the bathroom. They might avoid, going to movie theaters, particularly at crowded times, because they'd be worried if they all of a sudden had to use the restroom, they wouldn't be able to get out in time. They might avoid, taking the bus, for example, because there's no restroom on the bus, and if I had a symptom,
or the underground, perhaps.
The underground, exactly.
London or somewhere like that.
Stuck down there, and it was, stopped. So really organizing kind of your whole life around this fear of having this kind of sudden need to use the bathroom. And as you said, this can be a really embarrassing type of fear for people to have, and so they're not very likely to talk about it. They're not very likely to even know that other people have this fear, even though it's relatively common. But at its most severe, you could see then how somebody could end up feeling really uncomfortable leaving their house at all. And this could lead at its most severe to someone being completely homebound because they're just too worried about the embarrassment that might happen, were they to have this particular type of symptom attack. And so life can, again, shrink, really significantly.
So using that specific example again, so someone is avoiding, going on a car journey with other people. They're avoiding their normal routine. They're avoiding doing the things that they would normally do, and looking for the nearest bathroom is an absolute priority. And the first thing they think about when they get up, whatever, they're scared. So how do they get out of this? How do they start to unwind it if it's got kind of entrenched?
Yeah, well, we'd approach it the same way we approach, dealing with panic and all other types of anxiety, which is we'd really start to help the person map out, what are all the things that you're avoiding? What are all the places you're avoiding, the activities you're avoiding? And start to kind of rank those on, if you were to start approaching those again, which would be the kind of easier ones to start with and which would be the harder ones to start with. And so we then have people systematically start to approach those situations. So if the individual doesn't go to the movies, let's say, because they're too worried about what if I couldn't get out of the theater in time to get to the bathroom, we'd have them start by going to the movies at a time where there's very few people, maybe the middle of the day. So it's kind of an empty theater. And we'd have them do that a couple times. And then we'd have them go maybe in kind of the late afternoon when business is picking up. And then eventually have them practice, going at, 8 or 9 o'clock on a Friday or Saturday night when it's very busy. And then working up to sitting in the middle of the aisle or in the middle of the row instead of, right on the aisle. And so this really kind of systematic approach to those, what are scary situations for the individual. But the key piece with any kind of agoraphobia or panic is the person also has to confront the physical symptom or the physical sensation itself. So in this case, the person is going to have to really get used to the sensation of having a full bladder, because that really is the trigger. The trigger is this feeling of I need to use the restroom, and that is what sets off this cascade of fear. So we would also have the individual really work on, an intake of increasingly larger amounts of fluids to get comfortable with that sensation of just having a full bladder, and then having them practice an intake of increasingly larger amounts of fluids, and then going out into the places that they're so worried about being. And one of the things that people discover is that most people with this fear have rarely actually had the symptom attack that they're actually worried about. But, it does happen in life. And the other thing that they start to notice is that even if it did happen, the consequences are probably not as catastrophic as the individual believes. It is something that certainly would be embarrassing. Many people would be embarrassed by it. But the kind of level of social humiliation that people imagine, or the level of kind of scorn that they imagine that other people would have for them is really not terribly likely. And that becomes more apparent to people over time, too.
So in terms of, because a lot of that, I'm guessing, is around, again, their own thoughts about it and also what other people think. So how would they start to, if they're doing the physical exposure, how would they start to tackle their thoughts about it? Because I'm presuming it's the thoughts that start this chain of events. So how do they begin to challenge those thoughts?
Well, first of all, I always have people start by answering the question, how many times have you ever actually lost control of your bladder in a public place? The vast majority of the people that come to see me who have this fear, that has never actually happened. And so we really start to help people remind themselves, like, I've had a full bladder thousands of times in my life, and I've never, ever, been unable to get to the restroom in time. So this is something that just is very unlikely to happen. So we first have them just look at their own life, their own data, to get there. Then, when have you ever heard of this happening to somebody? Most people have never really heard of too many people this happening to. It happens to us, people in childhood sometimes. That can certainly happen, but as adults, it's pretty rare. Then what we would start to do is have people think about, well, how would you react if you saw this happen to someone else? What most people would say is that they would just feel bad for the person. They would feel kind of compassion for the person and would feel, sort of empathy that they were going through that. They wouldn't typically react with kind of like mocking them or like I said, kind of like great disdain or scorn or disgust. Like they would just kind of feel badly. And what that kind of does is it helps people see that, well, most people would probably respond in a compassionate way, and not so much like a rejecting kind of way. And so even getting people to think about how they would respond if they saw someone happening, in this experience can be really useful. So helping them re-estimate what's the realistic probability this is going to happen, and even if it did happen, would people react as terribly as you might imagine? So that's some of the tools we would start to use. The other is really just, okay, well, if something like this happened, what would you do? Like, problem solve it. Like, the reality is the person would not just stand in the middle of this public place, immobilized while everyone around them was mocking them. The reality is they would probably discreetly kind of leave whatever situation they were in. They would figure out, how to get a change of clothes or how to get home. Like, they would be able to do something to cope with the situation. And so we really want to help people think through, what would you do to cope? And oftentimes that really helps people see that this movie that was playing in their mind, almost like this kind of scene in a film of someone being really humiliated and everyone around them, sort of laughing or pointing and being stuck or immobilized is not terribly likely to happen. Like, they're likely to be able to figure out some way to cope with it or manage it, even if it's an embarrassing situation for them.
And is there any other kind of techniques you have around that kind of thing which could change someone's opinion of what other people think?
I think the other thing is really to start imagining, what are the whole range of responses that people could have? The thing with panic is we go to catastrophic so quickly, so it's like, the occasional person might be, a very kind of judgmental of that, but some people will not even notice, unless they're really paying a lot of attention. Other people might notice but offer to help. Other people might notice and just kind of ignore it. So, like, getting people to see the whole range of things that can happen is another way to break up this kind of all or nothing thinking that can happen with catastrophizing. But I think encouraging people to recognize that they can take care of themselves and they'll actually be able to respond to a situation if it were to happen is really important, because anxiety tends to create this feeling of helplessness, this feeling that there's nothing we can do, or that we won't be able to meet whatever the challenge is. And that in real life, that's rarely true. Like, most of the time when difficult things happen, people respond and they are actually able to do something, and reminding people that they're not helpless in the situation, and that there are things they can actually do to exert some control is a really important message to send.
And it's important to say, I guess, that we've obviously just used that as a very specific example, but we've done that because people can apply it to whatever fear they have. It's all about challenging their thoughts and challenging their behaviours and going into the situations that they were avoiding. You've touched on it before when we talked about exposures, but in these kind of scenarios, I'm guessing also it would be, they wouldn't just be exposing themselves to fear once or twice. It would be, they would need to keep doing it over a period for the anxiety to subside. Is that correct?
Yeah, that's absolutely correct. What we know is the way exposure therapy works, or approaching situations that you're afraid of works, is by doing it again and again and again and again and again. And it's that repetition that helps our brains learn that we're in fact safe and that the bad things that we fear typically don't happen. So you're exactly right. Someone would not be able to just go to the movies once and kind of have their fear disappear. I wish that was true. They need to do it many, many times. And so typically what we do is have someone pick a specific exposure to work on. Let's say it was, drinking a full bottle of water and then, going for a walk, in kind of the downtown area of wherever they are, and do that, maybe 4 or 5, 6 times before that actually becomes comfortable. And then moving on to the next situation that might be uncomfortable for them. If we sort of jump back to the way to approach kind of panic attacks, if a person is avoiding caffeine because it increases their heart rate, and then that makes them feel like they might be more likely to have a panic attack, that person might need to drink, coffee or soda that has caffeine in it 10, 15, 20 times before they start to get used to that feeling again. And so it really is that repeatedly facing those experiences that leads to change in anxiety and changes in the way that we think over time.
And the thing about all these interviews that we're doing is really to show people that whatever situation they're in currently, no matter how anxious they may feel or what type of anxiety they're experiencing, that they can actually take action themselves to move forward. And if they can't, then obviously they can, seek the help of a professional. But what we're doing here is giving a lot of pointers of the most successful treatments for anxiety that have been proven.
Absolutely, and the key there that's so important is even if someone doesn't have access to, a mental health professional or isn't ready to seek help, you can break these steps down into their very, 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 very smallest components and start work on that at home. So in the example I gave, if someone stopped drinking caffeine because it triggers panic attacks, people could start by drinking 1 sip of coffee, a day, or half a sip. People can start anywhere. You can find the smallest amount that you can handle and start there. If someone's avoiding the gym because the treadmill raises their heartbeat and get on the treadmill for 10 seconds, get on for 30 seconds, and then slowly increase that over time. So you're exactly right that people can find kind of a level that is doable for them, and that they can actually do on their own and then build from there. And you can almost always break that down into a piece that's small enough that somebody could start work on their own with.
So in other words, there's no excuses for anyone listening. If they've got issues, they can start to deal with them and take small steps. It's the small steps that count.
And another
that
thing
make the biggest result.
Yeah, and another thing that's great for your listeners to know is panic is actually one of the places where there's actually a ton of really great self-help workbooks that have been put out, and there's more for panic disorder probably than for just about any other type of anxiety. And so if someone was wanting to follow along, they're relatively easy to find and inexpensive, and someone could really kind of do the program themselves, sort of following along with those steps, and those tools are really readily available for people.
And probably the most important thing would be persistence, wouldn't it?
Yeah. I mean, most people need to really give this a pretty fair shot. Like I said, if they kind of do something once or twice, it's not really going to make that much of a difference. But if they really stick to small goals and they repeat them over time, people will really start to see changes and shifts in their behavior. And what's I think can be comforting for people to know is since, people are not born with panic disorder, they develop it at some point. It's important for people to remember that they didn't always experience this. Like they didn't always interpret these symptoms and signs from their body as being scary. They used to exercise and their heart would be racing and they didn't even give it a second thought. And that they learned how to become fearful of their own body sensations. And that the good news about that is they can unlearn, how to be fearful, and they can, relearn that those body sensations are normal. And that can be kind of a comforting thing for people to remember that this was something they learned and it can be unlearned.
And persistence pays.
Absolutely.
So you're going to be doing another interview with us in the next couple of weeks, and that's going to be on post-traumatic stress disorder.
That's correct.
So we will look forward to hearing about that. But in the meantime, Dr. Travis Osborne, thank you very much.
Thank you.